Innovation to me is about doing things differently, but doing things better. It's about testing new concepts and new ways of working.
Being at the forefront of things, being a pioneer.
Innovation means change, and it means change for the better.
Trying something new to improve patient care.
It's about being creative and develop the way we do things to make it more efficient.
Not necessarily by reusing what's been done already, but actually by thinking of something totally different.
And then in that can it only enhance the patient's journey.
Idea that springs to mind when I'm thinking of innovation is a wide open field, something that's fresh and new, and something that you can actually build on.
I think innovation's important because healthcare changes all the while.
Without it, it's almost as if the world could stop.
It's the way that you actually progress through life, not just for yourself, but also for an organisation as well.
The health service never stands still, and I think the organisation never stands still as well.
That we're looking at what we've got, looking at what the service that we're providing, and then thinking about what we should be doing.
It's part of reflection. How well did we do it last time? How much better can we do it this time?
So it's important that we keep changing, keep developing and keep moving forward with everything that we do.
It's important in terms of your own professional development because it makes work more interesting, quite frankly.
You know, we haven't always got to be the leaders in things, and we're not always going to be able to lead in absolutely everything for patient experience and improving things. So innovation is looking at other organisations and looking at other healthcare providers.
Patients have great expectations, and to meet their expectations we have to meet their needs, and therefore we have to continue to progress and improve.
The benefits of innovating across the organisation is the most important element of that, is making sure that nobody gets left behind.
It's about seeing as an organisation as an innovative organisation, therefore we're pushing the boundaries of making sure that patient care, quality, safety and indeed the patient experience is good and is high.
Improve the experience for the patient, we improve the way that staff work.
It provides the staff with new challenges. Again, if you've got to constantly strive to make things better, you don't become complacent, and complacency is one of the areas that I believe has a detrimental effect to patient care.
It identifies for me that the patients are not just nursed alone. They go through a whole journey of different departments for investigations, different treatments. So for me the innovation is across the site, so that the whole journey of the patient is the very best that we can deliver as a trust.
I think innovation benefits patients because it will ultimately improve their medical care, and it will improve their experience within the hospital.
New technology can be utilised to deliver care with the equipment that we utilise in the wards and in other departments.
Better systems with new ways of thinking actually supports patient outcomes, so it's about making sure that they're treated in a better way, so that actually they're seen and treated in the most appropriate place that they need to be.
From a communications point of view, we've started using social media to interact with the general public, giving people another means of getting in touch with us and of us communicating to them. We've got video podcasts on our website.
Look at innovation as part of allowing them to have the very best that Walsall can provide.
Because then we meet their needs, their wishes and their wants and their requirements, rather than enforcing things onto them that we think they want.
Well, in terms of innovation benefiting staff, I believe that challenge is a big thing. Getting people who've got qualifications to constantly address their continuing professional development, to make sure that that they're striving constantly to improve themselves, and by doing so improve the patient care that we actually deliver.
If we've got an improved service with better ideas, boost staff morale, service on a whole, if that's improved, then the patients are happier, and if the patients are happier, then we're happier.
It makes processes more streamlined, more slick and more efficient, and you would hope that that will make the staff's lives easier in their day-to-day work.
it gives the whole NHS staff a feeling of we're doing well, we're getting it right, because that's what we're all here for, we want to get it right.
Some of the innovation that I've done in the past is to do with the Golden Standard Framework, which was one of the pilot trusts. Certainly it has improved patient experience in the length of stay and accommodating their preferred place of care. And some of those innovative ideas is to do with length of stay, discharge planning, the admission process, looking at the observation charts, monitoring of patients and patient status at a glance.
We entered the Sally Hernando Library and Knowledge Service Awards, and we both won for the category of innovation for this unique service that's never been done anywhere before in the UK. Involved a rotational pharmacist becoming part of the library service team and working closely with the clinical librarian to deliver distinctive evidence-based research service to staff in the hospital.
Okay, well, there's two innovations I'd like to present here. The first of these is something called the ACT, which is a series of 5 questions, quite a simple questionnaire, that my patients are filling in the waiting room whilst waiting ready to come and see me. And the benefit to them is that it allows them to identify what their asthma test scores have been like, so that they save time when they come in to see me in the consultation. And just another example of innovation with the use of this ACT is that we're working with a group of teenagers on the introduction of this ACT score into an app, a mobile phone app. And the benefit for them is that it allows them to take control of their disease, of their condition. Personal management plan is another innovation we've brought into our department. And this My Asthma Plan, produced by Asthma UK, is quite a simple, straightforward guide for children and their parents as to what to do if their asthma is getting worse.
We were awarded funding to build a dedicated transition website specifically aimed at youngsters with long-term health conditions or disabilities transitioning from children's services into adulthood. As a result of that, we've now got a Facebook page and other group work that is continuously being funded. Linking in with Debbie's team and them also winning an award has enabled us to achieve what we wanted to.
Had an email come through from the Queen's Nursing Institute about an award for innovation, so we thought, you know, get some evidence together, see if we can present on a transition workshop and get some funding for it, which we did, and we were very successful.
The transition from children's services to adult services was being done, but it was quite poor. We found that a lot of the young people weren't accessing the services, so we felt that we actually needed to do more. We linked in with the health transition team to sort of say, well, you've already done this, can you help us? Can we use your experience to do something similar for our services? And so far we're working well together. It's developing. We're at the point now where we're now going to be starting with some workshops which are going to be peer-led, so that the young people who have already been through the system can come and tell the young people who are going through the system, say, this is what it's all about. This is how I felt at that particular time. This is what happened to make me change my mind and feel confident about what we're doing.
We're also doing strength and difficulty questionnaires when they start the workshop, so it's looking at them themselves, you know, where the strengths are, where their difficulties are, and we can get a score from that.
Essentially, from the Joint Commissioning Unit, we wanted to improve the care of dementia care in hospitals, so I contacted Jennifer in her role as senior nurse, and we looked at ways that we could improve care by doing some joint work together.
It was making sure that all the patients who attended the hospital acute part of the organisation had an effective experience while they were here.
We brought in various people from different organisations, including the voluntary sector, mental health and the acute hospital and the community services, and we got people to work together because we were all working towards the same aim.
It's made it more integrated, and we all now have a shared vision in terms of who's doing what to the patient at different parts of the pathway and experiences.
I think what we're aiming towards ultimately is improved outcomes for people with dementia and also their carers. So in terms of the hospital, it's a better experience while they're in hospital, so it's having their needs addressed, and diet and activity And in terms of outcomes, it's that while they're in hospital they feel that they've had a better experience and that more people go home and are in hospital for a shorter period of time.
And all of these types of principles and concepts for me are wrapped up in making sure that the organisation is an innovative organisation.
So that the people of Walsall do get the very best service that we can provide.